Hey, what's up, everybody? Welcome back to my channel. My name is Tamisha, the Codepreneur, as well as your transformational coach, keeping it raw, real, and relatable here on my channel. So today I want to talk to you guys about 10 awesome treatment interventions that you can do with your dementia patients. Now, keep in mind that these tips and ideas I'm going to provide to you, you have to use your clinical judgment when you are working with your dementia patient, because you have to understand and remember that there is different levels to dementia, and you need to pick what is most appropriate for your patient. So if you are ready to know what these 10 cool ideas that you can do right now, let's go. All right, so the first one, number one, is balloon volleyball. Yes, balloon volleyball. I like balloon volleyball because one, it's very simple and it's very cost effective. You could go to the dollar store, you get a bag of balloons for $1, and that's going to last you months. Okay. And all it is just having your patients tapping the balloon back and forth to you. They can do this in standing, they can do this in sitting, or maybe you can work with physical therapy and you guys can have your patients go back and forth. This is a really good activity for balance training. It's a good activity for coordination, and it's a very gentle activity, but it's a really good activity. So that is tip number one. Number two, cool idea that you could do is beanbag twister. All right, so this is the beanbag twister toss. You may not be familiar with this, so I'm going to just try to explain it a little bit more in detail. So the beanbag twister toss game, or activity I should say, is pretty much, think of the game Twister, right? Here's a picture of it, right? Now, what you're doing is you're having beanbags that match that activity. Now, you could go online like Amazon and you can order beanbags, or you can have your job invest and you guys can order beanbags as well as either the Twister game, or you can create your own. It's really up to you. The sky's the limit on this one. And what you would do is you can have your patients, you can spin the Twister board, and whatever it lands on, you can call it out, or you can have them see it and they can throw the beanbag to whatever spot it's being told. Or if for any reason they're just not safe doing it in standing, you could have them do it in sitting. And if you want to really take it up another level, you can make it a little bit more competitive in a group setting. You can now give them, I would say, a really lightweight bar, maybe like a 1 pound bar, and now they can push the bean back to whatever spot they're supposed to go to. And now you're incorporating strength, you're incorporating coordination, you're incorporating balance. So you're doing so much. You're incorporating hand-eye coordination, right? So you can take these ideas and these activities to another level. So that is activity number two. Activity number three is a sensory box. Yes, a sensory box. So you can have a box and you can use an old shoe box, and you can either have them go through the top, or you can have them go through the side and kind of seal it up. Then you're going to put items inside of the box. It can be textures, it could be rice, it can be different items. If you don't want a sensory box, you can do gardening where they're working with the soil. If you don't want to do gardening or have soil because maybe you feel like that gets a little too messy, then you can do clay and you can work with clay, or you could do therapy if you're really limited on your budget. You use therapy and you can work on the sensory, okay? You really have to be creative with these. You could take this and you can modify and grade it the best of your ability and how you choose to do it. Okay. Number four is art therapy. So you want them to be able to self-expression. So simply go to the dollar store. You can get yourself some paint, and you can do an activity with them and allow them to engage in storytelling. And you can even say, create an image and say, okay, let's try to mimic this image. All right. So now you're working on not just fine motor, but you're also working on memory. All right. So these are really good activities that you can do with your dementia patient on a low budget. Number five, in clinic safety activities. So what does this look like? So for example, what I've done before, and again, you want to look at the level of your dementia patient, all right? If your patient is completely dependent, this is probably not going to make any sense to do, all right? So in clinic safety can be something simple as maybe you have your patient in the kitchen, right? And then you put a towel on the stove and then you ask them, do you see anything here that can be a safety hazard or cause a problem? And then they can look around, right? Scan the room, and then they can identify, oh, wait a minute, that towel shouldn't be there, right? This is a really good activity, and you can really pick and choose what you like to do. Just like how I said, maybe a towel on the stove. Obviously, the stove is off, but you do something like that, and you put them inside of like a real life situation. Number six is basic ADLs. We cannot move away from ADLs, right? We can't move away from basic ADLs. So basic ADLs, your focus is not necessarily relearning. Your focus is really maintaining, okay, what they currently have and slow down that dementia progression. All right. So really you're looking at what can I do to help manage and maintain. So you're looking at repetition, you're looking at sequence. All right. So this is really important when you're working on any kind of ADLs. And also you want to make sure that you're using very simple commands, not too wordy, very simple, very straightforward, and very basic. Number seven is memory games. Yes, you want to do memory games. You can do matching games. You can do something called a clothespin matching where you can use paper, you can preferably a cardboard box, and you take a marker and you color it in and you color your clothespins as well. Again, go to the dollar store, guys. You can get it cheap clothespins, and then you color it and you just have them match the picture of the dot or whatever you did on the edge of the board to the clothespin. And that is, you're working on fine motor control, you're working on their memory. All right. So there you go. You have an activity right there on a budget friendly basis. Number eight is nature sound. So this, you can use your cell phone for this one, right? You don't even need to spend any money. It's simply putting a sound of an animal, and they can tell you, oh, that's the sound of a dog. You could put maybe a sound of a bird, and oh, that's the sound of a bird. So just nature sounds, right? And you can make that into an activity. Number nine is dancing, right? Play music. This is going to encourage social interaction. This is going to encourage physical exercise as well, right? Put on some music, let them dance. I know I did this before in the clinic where, we were doing our exercise and then a song came on and I was like, and I saw my patients just kind of moving and I was like, oh, you like this song? She's like, yeah, this is my song. So I said, okay, well, dance with me. And I made it into a balance activity where I had someone close by and I had the wheelchair behind her and I was holding her hand and I was like, okay, step forward with your left, step back with your left, step forward with your right, step back with your right. And we was just having a good time. So you can really, guys, I'm telling you, you can do so much if you just take time to really think about it. And then number 10 is your cone ring number toss. So what is a cone ring number toss? Of course, you can keep it basic. You can have just your cones and you can have rings and you can have them throw it. But if you really want to take it up a notch, is what you would do is you would go ahead again to the dollar store and you get like one of those name tags and you write numbers on it, like maybe 10, and you put it on the cone and then you go and you write 20, you put it on the cone, or you can keep it simple. You could do 1 through 10 and you put it on the cone and you can either say, okay, let's try to get to number 3. And they look and they try to aim for number 3. All right. Or you can even ship that and you could do a bowling out of it. You can get a ball or even a small weighted ball. You can have them practice with the bowling sequence, and now you're working on so much, right? You're working on fine motor, gross motor, balance, coordination, hand-eye coordination, like sequencing, memory. You're working on so much. So I hope that this was helpful. Definitely leave me a comment below. Tell me which one was your favorite and which one you're going to try. And if you have an idea that you was like, hey, Tamisha, what about this one? Definitely leave the comments below. You guys know I love to read your comments. And until next time, bye-bye.